You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new technology in dentures. It's called the New You Denture, and it's really changing the world of dentures. Beautiful teeth, natural results. In fact, almost give you, according to my first guest, a facelift effect. With us, we have an expert on the topic. We've had him on the program before, Dr. Marlen Martirossian. Dr. Martirossian, welcome to the program.
Glad to be here, Randy.
Now, it's called the New You Denture.
Yes.
Now, for people that don't know your practice, because you do more than dentures, I mean, who's the typical patient you see in your practice?
Let me tell you about my practice. We don't really have a typical patient. We see patients of all ages, all walks of life. We do run a general dentistry practice with an emphasis on cosmetics. In fact, everything that we do in the practice is geared towards cosmetics. Okay. We might get a patient that come in with a chipped tooth, chipped front tooth, and we end up doing either a bonding or maybe a veneer or to repair it. We get people come in not happy with their smiles, maybe their front six, social six smile, and we conservatively enhance their smile. We get people that come in for a total smile makeovers.
All right.
Whether they're not happy with discolorations of their teeth, maybe through grinding and clenching, they're missing a lot of tooth structure. The tooth structure gets worn down. People, when they smile, don't show too many teeth or too much of the tooth structure. So with the veneers, we can get them their teeth back, their tooth length back, and when they smile, they show all their teeth. We also have business people come in, they have crooked teeth, not happy with their smiles, and with the porcelain veneers, we can do an instant orthodontics. We call it instant orthodontics because in one day, from crooked teeth, they get a perfect
nice.
Smile.
Okay.
Randy, we are big on gum health. We have people come in to get their gums healthy. My hygienists are extensively trained in oral systemic connection. They know the importance of healthy gums to an overall health. In fact, with the special saliva test, we can customize the gum treatment specifically to that patient, to what kind of bacteria is present in the patient's mouth. We also take care of people that have gum disease. People come in with bleeding gums, puffy gums, unpleasant odor coming out of their mouth. So very conservative. Most of those people in general dentistry practice end up needing surgery. But with our approach, we actually do a saliva test. We find out what kind of bugs, what kind of bacteria is present in their mouth, and we customize that treatment to their needs. And we kill those bugs, particular bugs, and get their gums healthy. We have people that come in with TMJ, TMD dysfunction. Throughout life, they suffer with headaches, sore muscles, grinding and clenching. And through a neuromuscular dentistry, we do amazing stuff. Through an orthotic therapy, we realign the bite to a more comfortable, relaxed position. Years of grinding, years of suffering, years of headaches and facial pain goes away, sometimes even instantaneously.
Now, you have one of these practices where you do everything under one roof, right?
Yes, absolutely. We believe in that there's no reason for people to go from office to office to office to get treatments. So yes, when people come into our office, pretty much everything gets addressed in the office. Let me tell you about the sleep apnea. Okay. We get people that come in. In fact, the wives of patients bring their husband, drag their husbands in. They can't sleep with them in one bed. They can't share a bedroom anymore because they snore. They are loud snorers. Or they were diagnosed with a sleep apnea. They can't get a good night of sleep. They're constantly tired, and all that effect on the overall health. And through a special custom sleep appliance, snoring goes away. Also, we have patients that come in with bleeding gums, severe periodontal disease. They think the teeth cannot be saved. They don't want to go into the dentures because their parents, their grandparents used to wear denture, and they know how unhappy they were with dentures. So they come for solutions. And if they are not ready, again, to go into dentures, we can sometimes place a couple implants and do sort of like a snap-in and snap-off denture.
Okay.
Again, they get to eat better, they get to taste food better. For those people that we can't save their teeth, we take those teeth out, we clean up the gums. Those gums are nice and healthy. We place implants, and then we can give them either snap-on, snap-off teeth that they can chew better, they can taste the food better, function better, have a better quality of life, or ultimately we can give them a fixed teeth, something that gets screwed in and stays in. It feels like teeth, it looks like teeth, sort of like teeth in a day.
Now we're going to move on to today's topic. Not everybody, as you say, can afford dental implants or ready for dental implants. Maybe they're not ready for surgery or whatever. And you say there's a new denture that's beautiful. I'm trying not to put words in your mouth, but you love this. It's called the New You Denture, and it looks real, and they could eat and chew with it. Tell me about it.
Yes, it is the best alternative to the old grandma's denture for people that whether can't afford the implants or don't want to get involved with implants. So New You Denture is a patented way of fabricating custom cosmetic facelift-like denture that sheds 15 to 20 years of appearance, make people younger.
Now, how is it, help me understand, why is it so different than a regular denture? Because you say it's different, built different, looks different, fits different.
Yes, let me tell you a little bit about the traditional denture so we could compare. So how the traditional denture is made. Patient comes to the dentist takes a mold of patient gums, it goes to the laboratory slaps some teeth on the denture, and then it gets delivered to the patient. And then the process of adaptation to the new denture begins. Patients get sores, patient gets bleeding gums, patient gets muscle spasm. It's a constant coming back for adjustments. Never happy with the denture.
That lower denture, that's the toughest one to fit?
Definitely toughest one to fit. They never stay. It's like people eat and it comes out together with the food they chew. It's uncomfortable. No attention was paid to the patient's desires with traditional dentures. No attention was paid to the patient's lips, facial proportions, the bite or the sore jaws. But there's an alternative. There's an alternative of New You Denture. Okay. Let me tell you about several major differences between the New You Denture
and you have photos, by the way, you're going to show me.
I have plenty of photos.
Real. These teeth look real.
Absolutely. It's an amazing result. It's life-changing result that we get with the cosmetic dentures.
So I interrupted you. You were about to tell me how it's made and why it's so much different than a regular denture.
Yes. So let's talk about several differences between the New You Denture and the traditional denture. At best, traditional dentures replace teeth, while the New You Denture replaces teeth and the bone that was lost together when the teeth were extracted. People look younger because we replace bone that was lost during the extraction, not only teeth. Let's talk about function. When traditional dentures are made, we take a static impression of the patient's mouth. While when the New You Denture is made, we take a dynamic impression, and I'll explain what it means. So we have special equipment, it's called TENS. So when we take the impression for New You Denture, we take it with muscles in motions. It sort of mimics the way people chew, the way people talk, so we get much snugger fit for the New You Denture.
Backing up just a moment. So traditional dentures, they basically just put a mold on the ridge of the gum line, and that's it. With this, you're taking into their face, the way their teeth come together. Is that what you're saying here?
Yeah.
Okay. Sorry. Keep going.
So the dentures fit much better. They're much more snug. And another important part is, remember I told you after the traditional denture insert, patient keep coming back with sores. Almost never happens with the New You Dentures because of...
Why?
The way we take that impression again, that TENS unit sort of causes a deep tissue massage of the head and neck muscles. So it mimics the way people talk, it mimics the way people chew, and gives us a much more precise impression for the fit of the denture.
So it's like an extra step to make this fit just right.
Absolutely.
Now I'm looking at that photo because you said you hook them up to some sort of a machine to make sure that they're coming together properly.
Yes, yes, and that's the neuromuscular approach to dentistry that we do. Again, let's talk about the bite, because that's part of how we build the bite of the new denture.
So you got all these electrodes on your face?
Head and neck.
Head and neck.
Correct.
Okay.
So the way the traditional dentures are built, as I told you, teeth just get slapped on that pink. They put it together arbitrarily without paying attention to the muscles, without paying attention to the joint. That's why people that wear traditional dentures, they get headaches, they get sore muscles.
Is that right? Okay.
Absolutely. With the new denture approach, we connect them to the state-of-the-art equipment that literally tells us where we need to set up teeth. Set up teeth so the muscles would be relaxed, so the joint will function properly. And again, since it restores that lost bone, it gives people a 10 to 15 years younger appearance.
So you mold the teeth based on how their teeth come together, like a comfortable position. Then what, you freeze it and then make the mold from there?
That's exactly how we do it. Sure. We adapt that new denture to the patient facial profile and ultimately to the relaxed muscle. So live, when we take an impression and when we set up those teeth, we can actually see that position of the teeth where the joint is functioning properly, when the muscles are relaxed and in more physiologic position. And for people that get headaches, facial pain, muscle aches from a traditional denture, most of the time, because of the neuromuscular approach of what we do, of rebuilding the bite, headaches go away, muscle soreness goes away, the facial pain goes away.
So it's a cosmetic denture. So the materials, the teeth look better. You say the gums look better? What do you mean?
Absolutely. I was about to get to that. So the cosmetic part of the new denture. There are thousands of labs, dental labs in the United States and Canada. There are only a handful that can actually create that artwork that we put into the new denture. Similar to porcelain veneers, those teeth are set up with particular shape, porcelain, different colors, different translucencies.
What do you mean colors?
Patient picks the color.
Okay.
We sit down, we do the smile design, and we give a catalog of different colors, different translucencies, different textures to the teeth. And it's all customized to what the patient wants. We relay it to the laboratory, and those artists actually create those teeth to what the patient wants. Let me tell you about the pink.
Okay.
The pink part, that base part that surrounds teeth, it's hand layered by a ceramist just to make sure it has the most natural look, closer to how the gum looks like. It's a total art, Randy.
Look, you know, I did the research. To get a custom fit, this new denture is really not a big difference from a regular denture. Is it just people just don't know about it?
Absolutely.
Is that what it is?
That's exactly what it is. It doesn't have to cost
more.
What
is this I'm looking at?
You're looking at the state-of-the-art equipment that allows us to set the bite to its most relaxed physiological position to, again, get rid of headaches, to make people look younger, and to make people chew food and function better.
So this step, by the way, they don't do this when you get a regular denture.
Oh, absolutely not.
No.
No, general dentists, most of the general dentists don't even know about the procedure like that. But let me tell you about the diet. We talked about tasting food and functioning food. What do you think a denture wearer on a daily basis, what kind of a diet the denture wearer has on a daily basis? Carbohydrates. It's all they can eat.
Good point.
It's pasta, it's mashed potato. They can eat vegetables, they can eat meat. So it's an unhealthy lifestyle, eating carbs. And all the doctors nowadays tell us to cut down on carbohydrates. But unfortunately, traditional denture wearers can't do that because they can't chew meat. So now they can eat better. With a new denture, it's amazing. They get to eat vegetables, they get to eat meat, they get a better diet, better quality of life. Ultimately, they're healthier because of that.
Now, you say that people hold on to their dentures too long. What do you mean?
It's really a mind-boggling subject to me, Randy. The other day, in fact, last week, we had a patient, Alex. He's in his 80s. He came in for a consultation on new denture. And I asked him a question. He's wearing a full upper and lower dentures. I asked him, Alex, how long have you been wearing your denture? When he told me, I couldn't believe it. He said over 30 years. he was embarrassed by it. So when I looked
So he never
at
smiled because of it?
no, I couldn't get him to smile. No matter what I did, I danced in front of him just to try to make him smile. I couldn't.
Okay.
And when he actually removed that denture so I could take a look at his gums, I couldn't believe it. He was missing teeth, and those teeth were all worn down. That pink that's supposed to be a gum, it looked brown. There was definitely an odor associated with the old denture. In fact, people are embarrassed to be around other people because
Why did he
of
wait
that
so
odor.
long? I mean, he had such a bad denture. Why did he wait so long?
My guess would be that people think there are no alternatives. They can't afford implants, and they don't know about the cosmetic approach, customized approach to new denture.
Now, we're short on time, and I know you brought some photos, and they're good-looking
Plenty of photos.
So what are we looking at?
Andrea. So she came in complaining that she doesn't smile anymore.
That's her smiling?
That's her smiling, that's it. Let me tell you about the denture look. Have you ever seen a patient in denture?
Yeah.
Well, so what is a denture look? Let me tell you about the golden proportions. So our attractiveness to someone's body increases when that body is in symmetry and proportion. Similar with the face. If face is symmetrical and proportional, we tend to consider that face beautiful and get attracted to it.
Okay.
So what is the golden proportion of the face? Face is broken down into three parts. There's a top part, there's a middle part, and there's a bottom lower part. The lower part is nose to chin part. So what happens, and by the way, that part, the lower part, gets its support from teeth and bones. So when the teeth gets removed, the bone melts away, what happens is that nose to chin area starts to collapse, starts to get sunken in.
You get that witch look a little bit.
That's it. That's the sunken in, that's the denture look I'm trying to convey to you. So with new denture, again, not only we restore that teeth, like I told you, traditional dentures, they just slap a teeth, put it together, and done. We actually restore facial support. We give you the golden proportion back.
So that's taken into consideration when you're designing this?
Yes, that's one of the most important part that we take into consideration when we make new dentures. And by the way, this is Andrea after.
Okay.
She's finally smiling. And not only she upgraded her dentures, she upgraded her glasses also. And by the way...
And they look like real teeth.
Absolutely. Yeah, look at the corners of the mouth. Those wrinkles, those creases, they start to go away right away because we restore the vertical, that golden proportion of the bottom part of the face. And by the way, what I wanted to mention is that sunken in look, the denture look. Sometimes people that have teeth get that look also. Through years of grinding, years of clenching, years of wearing their teeth down, teeth get shorter, and again, that distance between nose and the chin starts to collapse.
So if you're continuing grinding and you do nothing, you're going to get that sunken in denture look.
Absolutely, absolutely.
Okay.
And in fact, I have my sister. She came in to me a couple of years ago. She was crying. She said, I keep looking in the mirror, and what do I see? I see my grandmother who had no teeth. I'm tired of not being able to smile. What can we do? So again, after the extensive workup and looking and customizing the smiles, we did porcelain veneers and look at that lower part of the face.
It's nice.
What we gave her is a non-surgical facelift.
That's your sister, right? So
That's
did you give her a
sister.
discount at all?
I did it for free just for her.
Okay, good.
But to tell you the truth, the plastic surgeon will be jealous at the result that we got with my sister.
So teeth make a big difference, according to you.
Huge difference.
I mean, it's obvious with her.
Yes, I mean, if you don't like your smile, if you don't like your teeth, if you don't like that breath of a denture, it holds you back.
Upgrade your denture.
Upgrade your denture. This is one of my favorite patients.
Okay.
Marlene. Marlene has the biggest personality I know. In fact, her personality probably works ahead of her. So when she smiles, she lights up the room. So Marlene came in to me with some broken down teeth on the bottom with an old denture. And remember we talked about the people wearing a denture for a long time? She's a denture wearer that's been wearing her denture for 15, 20 years, something like that. When I looked at her denture, She was missing some teeth. All the teeth were worn down. A lot of discoloration.
So people wear broken dentures?
They do. They do. It's amazing.
Interesting.
Lack of, I guess, alternatives that they think doesn't bring them to the dentist. So New You approach. We sit down with Marlen. We customized that look to her face, to her smile, because her smile is absolutely contagious. By the way, what I wanted to also touch on is the digital smile design. So this is something that we've been doing for the last couple of years. So we put the picture on the screen, and together with the patient, sitting next to the patient, we start designing teeth. We start designing the shape of the teeth, the color of the teeth. Those dentures get customized.
So they actually pick and say, I like that.
Yes.
When they see it on the computer.
Yeah, they go click, no, I don't like that. They go click, don't like that. Click.
Wow.
I think that matches me. I think that matches my smile. And again,
let's take a look at it after.
This is an amazing result.
Wow.
Do you think her smile is contagious?
Yes, looks good.
Do you think she looks 10 years younger?
Yeah, she's more attractive as well.
Look at those teeth that she's showing, a full set of teeth. Beautiful.
And this is a cosmetic denture. This is a New You denture.
Yeah, yeah. And when sometimes I show my patients a picture and they would not believe this is a cosmetic denture, they say, no, those are veneers.
You couldn't do this with a standard fitting denture. Make something like this.
No way.
No way.
No way.
So it's just the extra step of the technology, the computer, the smile design on the computer, fitting it to their physiology.
Exactly.
And then you get this.
Fitting it to their faces, fitting to their...
and stuff like that.
Oh yeah, yeah, she's back to chewing, she's back to socializing, she's back to hanging out with her friends. She got her confidence back. Again, she smiled on the first picture, but compare those two smiles.
Yeah,
it's a totally different person. Randy, this is Linda. Similar to other patients coming in with traditional dentures, not happy, can't chew. There's an odor coming from the old denture. So she's really self-conscious about her dentures. When they go out to a diner to eat with her husband, she's pretty much embarrassed. She's holding her hand just like that for other people not to see that she's wearing a denture. Similar to other process of sitting down and creating a vision for the New You denture, taking into effect the facial support, muscle relaxation, joints, etc. We created the New You denture.
Take a look.
And look at this person.
Looks nice.
Does she look 10, 15 years younger?
Yeah.
Does she look more sophisticated on that picture?
Yes, she does.
So on the first picture, we actually asked her to smile.
On the before photo.
On the before photo, and then she couldn't. She's barely showing her top teeth. And look at the picture after. She has a broad smile. Those corners of the mouth get filled with teeth just to give it a more natural appearance.
So how do people find out about what you do, about these New You dentures? Online?
Yes, people find us online. They know that there is a dentist in Bergen County, New Jersey, northern New Jersey, that specializes in cosmetic dentures. They look us up, they come. To tell you the truth, we spend at least an hour and a half on the first visit trying to listen to the patient's complaint, because most of the time patients diagnose themselves. We'll listen and then we sit down and talk about what we can do to enhance their smile.
So we're short on time, but we'll try to get in maybe one more.
Sure, Randy. With your permission, I'll show another one or two. They are like babies to me because it's like a life transformation. It's really rewarding. So this is Joel. Came in with broken down teeth, pretty much terminal dentition. He couldn't chew, he couldn't eat, he couldn't function. He goes, do something, give me something so I could chew and give me my smile back. So we sat down and we discussed what were his options. One option is implants, but Joel didn't want to go into the implants because of financial reasons. The other option was the old grandma's traditional dentures. And he knew from past experiences of his mother and grandmother that there's no chance in the world he would be able to wear a traditional denture. That's where the alternative of New You denture works perfectly. Gives you the look back, gives you the function back, gives you self-confidence back. Ultimately, again, gives you new life.
It looks good. Looks
very good.
Okay, one more.
Barbara, similar. Comes in, not happy with her old traditional denture. She said, when I smile, I don't show any teeth. I am a social butterfly. I go out with my friends, but I want to be able to smile and show my teeth, be able to eat, and etc. And again, this is Barbara after. I want you to pay attention to that lower third of the face we talked about. Look at all the wrinkles, all the creases around the corners of the mouth.
The distance from her nose to her chin have changed.
Sure.
It's
Sure,
like
that
opened
proportion.
up, like you were saying.
Yes, yeah, we gave her her proportion back.
That's a good looking denture. I mean, that looks like a real set of teeth.
Absolutely like real teeth. Here's another patient. Guess what she complained about when she came in?
What?
She spends a lot of time with her grandchildren. Grandchildren make fun of her that she has no teeth. She does have teeth. She has traditional dentures, but because all the wear and the way the traditional dentures were made, she doesn't show any teeth. So she asked, like any other patient there, give me my look back, give me my teeth back, give me my youth back.
Okay.
And here, look.
Wow,
Can you tell me
that's
who
a
looks
denture.
young
That's
in
a
that
nice
patient?
looking denture. That's nice looking teeth, I should say.
Yes. And look at her smile. It's back. It's a new you person.
Is that right? Now, we're out of time, so I want to thank you for coming on the show. So final message. Somebody has their denture. Mm-hmm. Maybe their spouse has a denture. They never smile because they don't like the way it looks. Mm-hmm. They're not quite ready for dental implants. Mm-hmm. What do you say to them? But for whatever reason, they're afraid.
Mm-hmm. I mean, if you're looking for a better smile, if you're looking to be able to eat better, if you're looking for more confidence, if you're ultimately looking to look 10 to 15 years younger, New You Denture is the alternative.
Okay, good. What's the turnaround time? I mean, in a perfect world, everything goes perfectly. If they go in there tomorrow, they could have their new teeth in what, a month?
Approximately a month. Well, usually there are 3 appointments from start to finish if they already have a full denture. So yes, for the traditional denture, it takes whatever 5-6 appointments. With the New You Denture approach, with all the equipment, the state-of-the-art equipment that we use that regular dentist doesn't use, we can turn it around in 3 appointments.
And people are financing this. Is that right?
Yes, yes. No, we have.
Insurance doesn't cover this.
No, most of the time insurance doesn't cover it. And we do have lenders that we work with that can give you interest-free options for up to a year to be able to get that new you look.
With decent credit.
Yes, absolutely. Okay. But don't hesitate. You can call us and speak to my new patient coordinator. And again, we spend plenty of time listening to all your concerns.
So if you live in New Jersey and you don't like your denture, come see you.
So if you live in New Jersey, and in fact, you don't have to live in New Jersey, but if you're looking for a more customized cosmetic approach to a denture, come visit us.
Because people come great distances to see you.
Yes.
Is that right?
Absolutely.
Other states?
In fact, majority of the patients that come to us for facelift dentistry, for facelift-like dentistry, for New You Denture or cosmetic dentistry, come from surrounding area, not necessarily from North Jersey. They come from Connecticut, Pennsylvania,
okay,
New York, etc.
Okay, good. I want to thank you for coming to the show. Great stuff.
It's a pleasure. It's a pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.